Hello everyone. So today we are going to talk about acute epiglottitis, that is a supraglottic condition of larynx, so named supraglottis laryngitis also. Now before the advent of Haemophilus influenza vaccine, the most common cause used to be a Haemophilus influenza infection leading to the epiglottitis. But with advent of the vaccine for Haemophilus influenza and wide immunization for it, the cases because of it have reduced, and the most common cause is now a group A beta hemolytic streptococci. Other causes too, like Staph aureus, Streptococcus pneumoniae, are also there, but they have a minor role. The important one is a group A beta hemolytic streptococci. No viral epiglottitis is known. Okay, and clinical features in a child. Okay, if a child gets epiglottitis, there will be acute onset of fever. Okay, and other constitutional symptoms like increased pulse and anxiety, restlessness, and there will be characteristic inspiratory stridor due to involvement of supraglottic part. And to relieve or to uh, reduce the resistance in the airflow, the child will attain a position that is tripod position. Okay, this is a position where patient is bending forward. This reduces the resistance to airflow and relieves the patient. Okay, another thing is the patient will have difficulty in supination because the whole edematous tissue will block the pathway of respiratory flow. Now, other things are that because of this inflammation, there will be drooling of saliva and odynophagia. These symptoms are because the inlet of the larynx is inflamed. That will so when food passes behind to the oropharynx, passing above the epiglottis, it causes pain. The another thing is the child will have a normal cry because there is no involvement of our glottic part. The other thing being that if the same epiglottitis occurs in adult, the symptoms are milder, means the patient will have sore throat and odynophagia. This is because in children there is a lot of submucosa tissue that causes a serious edema in the laryngeal structures, but this is not the case in the case of adult because there the submucosal tissue is less. Okay, so the edema is lesser compared to the children, so are the symptoms. Now diagnosis is made by an indirect laryngoscopy, but it is contraindicated most of the time because this indirect laryngoscopy can lead to the laryngospasm. Okay, and the child will end up into ARDS. So, however, if you do an indirect laryngoscopy, you will see a hyperemic and swollen part of our epiglottic area. And another diagnostic modality that is widely used is the X-ray, where you will see a characteristic thumb sign. As you are seeing in this image, the epiglottis will be swollen, appearing resembling a thumb. So is it named. In management of this condition, since it is caused due to a group A beta hemolytic streptococci, these beta lactams are the drug of choice. Okay, and to if the inflammation is to a severe degree, we also use steroids. And after even using these two, if there is no effect, we have to maintain the airway either by intubation or tracheostomy. So this is how this condition is maintained. Okay, so this is all about epiglottitis. Thanks for watching.